So the good news is that majority of our heart conditions can be treated with just medicine. So I would say 90% of treatment is actually just medications. We've got lots of medications that's been proven to prolong someone's life, improve your symptoms. So rest assured, majority of time, most patients will be just taking medications to control their heart conditions. There are, of course, the remaining about 10% of patients who the medications alone are insufficient, and then we need to think about procedures. So when we talk about procedures, we do have minimally invasive procedures, and we have, of course, open heart surgery in the cardiac field, right? So again, technology has advanced over the years, so majority of our treatment is minimally invasive. A common condition, a common procedure that we would hear about is this thing called coronary angioplasty. Right? Coronary angioplasty is for the treatment of blockages in the heart arteries. So the vast majority, medicine is good enough, but if you have a critically narrowed artery, then we will want to, that medicine cannot unblock. So we will need to physically unblock it. And how do we do it? It's through a minimally invasive procedure. It can be done through an incision in either the wrist these days, or if it's not accessible, we can go through an incision in the groin. So through that, we will push a catheter to the heart, and through that very, very tiny catheter, which is only about 3 millimeters wide, we can deliver a stent or a balloon to the area where it's narrowed, and then we can expand it and put a stent in place to keep the artery open. So this is minimally invasive procedure that can be used to treat most blocked arteries. We do also, for some patients who cannot be treated with just this minimally invasive procedure, then we have open heart procedures. So if we've got very well trained cardiac surgeons who can actually repair the heart. So if the heart valve is damaged, we can open the heart and change the valve or repair the valve. A very common procedure is called a coronary artery bypass graft. So, or in short, we call it a CABG, or we call it a bypass surgery. So for patients with blocked arteries that's not amenable to just angioplasty or stenting, then they will undergo an open heart coronary artery bypass surgery. These days, for certain suitable conditions, we also have minimally invasive surgery for bypass operation. So instead of a traditional long cut down your chest bone here, some of the surgeons may be able to do it through smaller incisions on the left side of the chest, on the top part of the chest. So we have different ways to treat the blocked heart arteries or coronary artery disease. So and we will customize it or individualize it according to our patient's needs.
Okay, this kind of cardiac procedure is definitely covered under integrated shield plan. As for cover, how much? It very much depends on your insurance plan, as well as whether do you take up the rider. Okay, but government actually imposed this 5% self-pay, so they will not have any 100% coverage. But we can complement it with our corporate insurance. That means I claim under my own personal shield. Later on, okay, I submit to my company insurance to cover the non-claimable portion. So both plans actually can complement each other. Angioplasty, it will be covered under the critical illness policy because it's minimally invasive procedure. So the payout will not be 100%. It really depends on your policy wording. Some actually 10%, some actually have a maximum 25% kind of thing. You have to refer back to your policy contract. If I claim the 10% for the angioplasty, the remaining sum assured is still there. In the markets at this point of time, the critical illness policy no longer like one-time claiming. They can allow multiple claiming. So it's really back to your policy contract. What kind of policy it actually cover you at this point of time?